This is an abbreviated surgical technique for the BioPro Modular Thumb Implant. The procedure begins with the resection of 5 to 6 millimeters of bone from the base of the first metacarpal, angled approximately 15 degrees. A precise cutting guide is provided to assist with this step. The guide's tongue is designed to rest within the joint space against the metacarpal base. Once the resection is complete, the cut angle can be verified using the alignment guide. The pin of the alignment guide should be parallel to the long axis of the metacarpal. Next, a small socket is prepared in the trapezium using the supplied rotary burrs. Begin in the center of the bone, gradually working outward until a socket measuring approximately 10 millimeters in width and 5 millimeters in depth is formed, maintaining a strong radial and dorsal rim. The socket is then enlarged using hemispherical burrs, starting with a 12 millimeter burr. Progressively increase the size until the appropriate socket has been achieved for the patient's anatomy. With the socket prepared, the surgeon uses the head sizing guide matching the largest hemispherical burr that was used to trial different head heights, 0, +2, and +4 millimeters. This is done to evaluate implant fit, joint tension, and range of motion. Now the metacarpal is then prepared using the stem broaches. Begin with a smaller broach and progressively increase the size to fully compress the cancellous bone, creating a secure interference fit. The final implant will fit tighter than the broaches as it features a plasma spray coating. Next, insert the trial implant components, matching the selected head and stem sizes. Once fully assembled and seated in the joint, assess range of motion, joint stability, and confirm alignment with fluoroscopy. With the optimal fit and positioning confirmed, insert the final implant into the joint and proceed with skin closure. Post-operative radiographs may show gradual sclerosis of the cancellous bone surrounding the trapezium socket within the first year. This natural bone remodeling enhances stability and helps prevent implant subsidence. The BioPro Modular Thumb Implant is designed to restore strength, stability, and mobility, offering patients long-term function for years, even decades.